Okay, so tell me a little bit about yourself and how you got involved in the disability community.
Yeah, so I'd always planned to go to medical school. And the summer before my senior year of undergraduate, I started my preparations to take the MCAT and apply to medical school. But as I started that process, something just didn't really feel right in my gut. And I started questioning if that was the right career path for me. I was taking summer courses at a local university, and on my lunch break, I would research various health professions in my car. Through that research, physical therapy piqued my interest. So after I finished taking a test one day, I drove around town to multiple physical therapy clinics asking if I could volunteer to gain observation experience while also helping their clinic out. And after multiple clinics declined, I finally came across a clinic who agreed to let me volunteer, and I started volunteering and observing in that clinic the same day. I was instantly intrigued by the rapport that physical therapists build with their patients. And I loved hearing about the incremental progress that patients made and the associated positive impacts on their quality of life. So all of that was really impactful to see and to hear those experiences. And I quickly felt like physical therapy could be the right fit for me for a career path. Regarding getting into specifically neurologic physical therapy, I've always found the nervous system fascinating, even when I was really little. So in PT school, I was naturally drawn to the neurologic courses. And everything related to neurologic physical therapy made more sense than some of the other specialties. So I was fortunate enough that when I graduated PT school, I went straight into a neurologic physical therapy residency program at Boston University. And I had amazing mentors who helped me refine my clinical reasoning and gain experiences not only treating patients with neurologic diagnoses, but I was also provided with opportunities to participate in teaching and research related to neurologic physical therapy. So that experience solidified that I had a big passion for all things neurologic physical therapy. And I've gotten some experiences to work in some big hospital systems in the Dallas-Fort Worth area. So I've worked with a lot of people with a variety of neurologic diagnoses and some very complex cases. So in my current role, I've been able to help grow the neurologic physical therapy programming at a satellite clinic for UT Southwestern in Frisco, Texas, a suburb of the Dallas-Fort Worth area. And it's been really cool to see the growth and fill a huge need in the community. Because I think neurologic physical therapy is somewhat hard to find in certain areas. And so it's been really cool to see our programs grow and provide care to people with various neurologic diagnoses in our area.
Hmm. My next question is, what sorts of things do you do as a neurologic physical therapist? What's that all about?
Yeah. So I work in the outpatient setting, and I see patients who have all different kinds of neurologic diagnoses. So this includes people with vestibular dysfunction who are dizzy, people post-traumatic injuries like brain injuries or spinal cord injuries, people post-stroke, people with muscular dystrophy, people with diagnoses like Parkinson's, multiple sclerosis, ALS, and then a bunch of other diagnoses that I won't list. But just anything neurologic, I probably see it. And so every day I love listening to people's goals and getting creative to challenge them and simulate situations and activities that they want to improve. I think it's super important to listen to the patient and tailor their exercises and experience in physical therapy, just any activity you perform to their goals, because then they're going to get the most out of it. And it's going to be the most meaningful to them. And so my big goal is to help people improve their quality of life in any way possible. And I really enjoy learning and collaborating with other therapists to further my knowledge and skills and help my patients. But I also often have the opportunity to help mentor other neurologic physical therapists. I've had the opportunities throughout my career, but it's something I definitely enjoy, as well as mentoring students to help grow their knowledge and skills. And that's been really exciting as our clinic grows and we keep building on providing more neurologic and really good neurologic physical therapy to people in our area.
Mm-hmm. My next question is, what methods or approaches do you use as a neurologic physical therapist to help patients, guide, find their best path forward to independence and
So I think,
self-autonomy and
yeah,
self-autonomy? Mm-hmm.
yeah, I think just listening to people is the big thing. So, I mean, depending on what their goal is, um, I often like if somebody tells me that, they have a goal of getting back to playing golf or they want to be able to cook a meal, then I'll try to break down the components of that activity and figure out how I can work on like strengthening and balance related to those specific activities, and then work towards building that entire activity back together as best I can simulate in an outpatient clinic to try to maximize their ability to do their specific goals.
Mm-hmm. My next question is, who are the key players that you work with? In other words, who are the stakeholders that you mostly engage with?
Yeah. I work really, really closely with a interdisciplinary team, and that's made up of other physical therapists, occupational therapists, speech therapists. I collaborate frequently with various physicians of different specialties, and mental health providers, as well as I'm sure there's lots of other professions that I collaborate with, any healthcare profession. But we all collaborate and discuss patient cases to help optimize outcomes for our patients. I often also collaborate with equipment vendors to help obtain the proper equipment for people. So this can be things from like wheelchairs to standing frames, or braces for people. I would say though, the biggest stakeholder would be the patient and their family and like support community, because the patient's goals drive my treatment and the therapy goals. So by far the patient is the most important stakeholder.
Mm-hmm. My next question is, what impact does your work have not just on yourself, but also people in the disability community? Like how are you been able to be that sort of facilitator and who sort of looks at what works best for each patient?
I think listening to people and then building ongoing relationships so that patients get the care they need and know that like it can be ongoing. So, say right now is not a great time for physical therapy, reminding them like you can always come back to physical therapy, get a new referral from your physician. We can pick back up when it's a better time, or say they kind of plateau with their goals, just making sure they know like, you know, work on these things that are going to help get you to the next level for these goals. And then telling them to come back and just reminding them that, if you've got like chronic impairments, if you've got a chronic condition where you're dealing with challenges, having an ongoing relationship with a physical therapist is important, or any physical therapy, speech therapy, occupational therapy, it's all important, because we can help continually improve, and it's not a one and done kind of situation. We can always help.
Mm-hmm. Lastly, how can neurologic physical therapy, lead to positive health outcomes?
We can help prevent changes in the body. So the body changes obviously as we age. And then if you throw a neurologic diagnosis on top, there can be additional changes that occur from the diagnosis itself. And so having physical therapy, occupational therapy can help prevent additional things from occurring. So big things that we try to prevent are contractures. So like when joints get really stiff and muscles shorten and it's hard to like straighten your leg, we can try to help prevent that. try to help prevent postural changes that can come with different seating, positioning, angles and stuff. So we can try to help prevent negative changes from occurring so that people maintain kind of optimal postures, positions, and can with that maintain their level of function for as long as possible, or continually improve their level of function.
Cool.